Stephanie and Chad Sievers were stunned when their son Landon was born with a cleft lip and palate.
In the beginning, it was it was a complete surprise. We had no idea that Landon was going to be born with cleft lip and palate. So a lot of emotions, you know, when you first find that out.
It's an undetectable birth defect that can occur in as many as 1 out of every 750 births. When the tissues of the mouth or lip don't form properly, the result can be a cleft lip, cleft palate, or both cleft lip and palate. Correcting the defect surgically requires a complex series of surgeries that can take several years. That's because the body outgrows surgical procedures normally employed to correct cleft lip and palate. The Sievers heard about a new technique being used at Cardinal Glennon Children's Medical Center, which is changing the way medical science is approaching this problem.
I came to the conclusion that when a surgical procedure in a growing child yields a predictable pattern of relapse, the underlying idea can't be right.
Dr. Karstens has more than a casual interest in this field of plastic surgery because he was born with a cleft lip and palate.
And so I surmised that the soft tissues, if a cleft occurred, the soft tissues would be somewhere else, but you could find them. You could put them together, and therefore you could create the soft tissue box of the missing Lego piece, and then you could stuff it with something. I did an experiment where I looked for the blood supply of the internal carotid that goes to your brain and external carotid that goes to your face. And I found that there are some specific branches of the internal carotid artery that go to the face. They don't just stop in the brain, they go to the face, and they come right down the middle and stop. And I found that in the cleft surgery that we're doing traditionally, we were dividing that field. We were dividing a field which embryonically was supposed to be unified.
Dr. Karstens is developing new technologies and surgical procedures which offer a lifelong solution to cleft lip and palate, a genetically engineered protein that stimulates bone growth.
We created a chamber surrounded by bone-forming cells, and then you could stuff it with something. And then came along BMP. And BMP is known as bone morphogenetic protein. This is a substance which is native to all humans, to all mammals. We all have BMPs. There are about 20 of them. As a matter of fact, one of the BMPs, BMP4, tells the neurons to go up or to go down. So it's that fundamental. BMPs fulfill multiple different roles. But BMP2 will cause your body's own stem cells to change from an undifferentiated form to become bone-forming cells. It will drive them into a mature state. So if you're an immature stem cell and I stimulate you with BMP, you will suddenly become an osteoblast and you will make bone.
Combining the bone growth material with surgery has had dramatic results in patients like 2-year-old Landon.
Pretty amazing. You know, 2 surgeries, you know, that's it.
It's been very, I don't know. I mean, it's been more emotional than anything, being stressed out with it and, you know, being worried about him, but now we're happy.
So I would say then that the creation of the developmental field reassignment surgery, DFR surgery plus BMP, has allowed us to have an approach to clefts that is like scaling an unclimbed peak. We've been able to finally do a cleft repair and hopefully prevent the dental collapse that occurs in 100% of the patients otherwise. That's a significant achievement.
This new breakthrough at Cardinal Glennon Children's Medical Center in St. Louis is offering hope to children worldwide. For the St. Louis Science Center, I'm Al Wyman.